Thank you to the Johns, not for the 50-year comment. And thank you to the Academy for inviting me. I think this is a great session, and I love the pros and cons piece because it really does bring forth some interesting concepts. So today I'm going to be talking about sort of the animal piece, which for us in Canada for surveillance really is represented by the Canadian Integrated Program for Antimicrobial Resistance Surveillance, or CPARS. And I'll try and figure out how to use this. Okay. So I just want to echo some of the concepts that Dr. Mathani had raised in terms of the complexity. There's no simple way of looking at AMR, and that's why we do look at it from a One Health perspective. So without delving into all the complexity, we can start to answer the question which was posed to all the speakers today, which is, are we effectively detecting and monitoring trends to inform strategies and reduce the risks? And so my thought initially was, well, it depends on the question and the population at risk, because I'm trained as an epidemiologist. So this is sort of what was posed to us back in the late 90s. Yeah, it's not been 50 years yet. Yeah, it feels like it. So what influenced the initiation of us actually looking at the animal and the food chain was the Consensus Conference, which was 1997, and I started waxing nostalgic when thinking about people like Shirley Payton, who was so influential in getting people around the table to start talking about antimicrobial resistance. So the Consensus Conference was really the first time when they sort of had the vets and the EPIs and the microbiologists on both the human and animal side sitting down together and coming up with 27 recommendations. So that was an important piece, as well as a 2002 Health Canada Advisory Committee on animal uses of antimicrobials and impact on resistance and human health. I didn't come up with that title. I think Scott McEwen did. So for those who were actually at that, and there are several around this room who actually participated in that, the recommendation 11 was to establish a national surveillance system to monitor antimicrobial resistance and use in the agri-food and aquaculture sectors. And Dr. Robert Clark, who was my director back then, came back from the meeting and said, do you want to hold a meeting or get some people together and see if we can do something about this? So that's how I got involved. And then, through that whole sort of late 90s, early 2000 period, Health Canada Veterinary Drugs was also looking at this issue and trying to sort of wrap their head around what sort of recommendations were needed. So they hosted this expert committee, and it was chaired by Scott McEwen, and we were very happy to have people like Don Lowe at our table to provide the perspectives that was needed to start to really put this One Health sort of piece together. So the recommendation out of that, again, helped CPARS develop, which was need for a national monitoring program on antimicrobial use in food animals. And that the system needed to be ongoing and permanent and representative and all those kinds of things for surveillance. And that we needed to have a design that would support risk analysis, to be able to integrate along the food chain with human surveillance initiatives, and that basically recognizing that our major trade partner is the US, so we needed to ensure that we were comparable to the National Antimicrobial Resistance Monitoring System from the US. So with that direction, I sat down at a table, and actually it was John Prescott who gave me an earlier version of this from Linton, which was much simpler. And then I started thinking about all the different areas where things are linked. So we have the human side, obviously, but we also have the food animal components where antimicrobials are used quite extensively, and also in companion animals. But everything is all connected. And then I started thinking about, the aquaculture industry, certainly they are using antimicrobials and can be sources of contamination through the environment. And then you got the effluent piece, and then you've got the feed piece, fuel ethanol, and distillers' grain byproducts going into feed, and then applications directly onto seed and crops and food. And then you've got your industrial and household antibacterials and chemicals. And so looking at all this and trying to figure out how do we design a surveillance system that actually represents what the exposure humans are facing from antimicrobial resistance arising from the food chain. So we basically started looking at sort of this piece, which ended up being sort of the retail piece, the abattoir piece, the farm piece, and then as much as we could, what was representative of what a human exposure would be. So at the beginnings, it was difficult, to say the least. There was a lot of finger pointing between the medical and the veterinary community, saying it's your fault that this is a problem, and no, it's not, it's your fault. And so there was a lot of denial on the agriculture side that we had any impact on human use, because they'd bring up things like gonorrhea, like realistically, you know, what does an animal use have to do with gonorrhea? So there was those kinds of conversations. They were very interesting. It wasn't considered it wasn't considered a food safety issue. You know, we've got salmonella in food, so what? So what if it's resistant? So recognizing now that the link between resistance and the virulence and various other aspects, that obviously it is a food safety issue. So there wasn't any infrastructure for collecting antimicrobial use or resistance in Canada at that time. There was no passive surveillance systems that we could really build on that would make sense. There were things like residue avoidance programs, but those don't really address the antimicrobial resistance issue. We had an OIE reference lab, which is the animal piece for trade, and they were collecting, you know, clinical isolates of salmonella, but they weren't representative, and it was very hard to find sort of a denominator to sort of see what sort of level these represented. And then there was some sampling done by CFIA, but it was mainly for ready-to-eat meats and some export meats. So that really wasn't going to give us the picture of what Canada looked like. So we really needed a new approach in design. So we came from a very strong epidemiology background and sort of designed the system based on very strong statistical principles. So typical surveillance program, same as any other surveillance program, you want to look at trends, where we were looking at that point, and we still do, look at MICs, but we're moving into a whole genome sequencing world and trying to figure out how that's going to be reporting, so that's a whole new complexity that's coming into our system. We wanted to be able to integrate the data both across the animal and the human components, be timely, facilitate the risk analysis piece in terms of the human exposure, and then allowing accurate international comparisons. And at that time, it was really the United States and Denmark back in 97 were the ones that had systems up and running at that time. So they both have their 20-year anniversaries, and CPARS is our 15th anniversary. So I just want this to sort of describe that we didn't all have everything wonderful at once. We started very, very early on recognizing the WHO had global strategies that we were looking at. The 97 Consensus Conference, as I said, so this was the impetus, and this was the design phase where we really started to think about how we're going to look at antimicrobial resistance. So resistance initiatives is on the bottom, and use initiatives are on the top. So on the resistance side of things, we had the passive stuff from the OIE reference lab, and then we started in CFIA abattoirs and looking at beef, chickens, and pigs. So that was an easy one because we could just take cecal samples from pigs and chickens and beef at slaughter, and so that was relatively easy. Then we moved into the retail side of things in Ontario, Quebec, and then we started our human piece, which was the provincial public health labs forwarding salmonella isolates to NML. And then we moved, again, just expanding, reducing, expanding, whatever. So through various inputs of financial resources, we've been able to sort of try and grasp various aspects of the food chain. On the use side, that was easier on the human side because we had IMS Health collecting use that we could purchase. And so we analyzed that to give some estimates on the human use. But on the animal side, it's a quagmire of a distribution system in terms of antimicrobials available over the counter, antimicrobials prescribed, antimicrobials going into food, all these different aspects, and it's a very complex system. But there was an advantage in that we obtained from a collaboration with the Canadian Animal Health Institute, which is represents pharmaceutical manufacturers of antimicrobials in Canada for vet use. So they started providing their annual sales data. And then we were able to start a farm-level surveillance because really we needed to understand where, when, how antimicrobials are being used at the farm level. So we started with swine back in 2006 and in farm chicken in 2013. And right now we're working a lot internationally on trying to develop methods for reporting use across all the different sectors so that, countries can be compared. So this is what CPARS looks like now. So this is sort of our framework. And so we've got our human population and the animal population we have the sick animals, we have sentinel farms, abattoirs, and retail meats. And then on the use side, we've got the antimicrobials going into humans from IMS Health data, antimicrobials sold for use at crops. We're hoping to get something on aquaculture shortly. So we have our sentinel farm use questionnaires that go out to all the farms. And then we have this sales data. And all of this comes together under our integrated system. Just recognizing methodology is very important, and standards and transparency in terms of what we were doing. So we elected to use the same methodology as the US system. And we work very, very closely with the epidemiologists and microbiologists at NARMS with monthly meetings and annual meetings to make sure that we're all discussing and using the same methodology. We're also contributing into the European system for epidemiologic cutoffs, and as well as CLSI for interpretation of results. So additional screening, because our screening is based on a plate, a broth microdilution plate, which at the time didn't have a lot of wells to add in what was needed for ESBLs and colistin. So there's additional screening, as Mike has mentioned, for ESBL since 2010 on the human side, and then colistin resistance since 2016. And now whole genome sequencing is being conducted on a subset of the CPARS food isolates and on all the salmonella isolates. So this is what the human side looks like. It started in 2003, and it's provincial public health labs forwarding isolates into NML. To save money, we were really only looking at the top serovars. So as of 2010, we look at Heidelberg, Enteritidis, Newport, Typhimurium, 4,5,12I-, and then the host-adapted Typhi and Paratyphi are also brought in. But there's special studies that are done on certain serovars that are showing a lot of resistance. CAMPI is also another area of priority for the Public Health Agency of Canada, and it has been difficult because a lot of the provincial public health labs throw their CAMPI away, so we weren't able to get sort of a system in place like salmonella where we could forward isolates. So, but we are partnering with the FoodNet Canada, where they have the private labs and public labs that actually are keeping the CAMPI so that we can get them forwarded to NML and actually have susceptibility testing done on the human CAMPI. So that's a positive forward step. So retail surveillance is something that we got into a little later in the system, but an important piece in terms of human exposure to food products contaminated with an antimicrobial resistant organism. So we've sort of waxed and waned in terms of some of the provinces, but we are still present in British Columbia, Alberta, Ontario, and Quebec. And we have continuous sampling, so we have field workers going out and collecting meat samples in these provinces at various retail establishments. We do have a little bit on fresh fruit and vegetables from some of the CFIA targeted studies when they actually isolate salmonella from them. So these are the organisms we're looking at, and these are the products that we also look at. So abattoir was one of our earliest ones. There's usually between 50 and 60 plants across the country that we have samples being taken from. So cecal samples are taken online from the various slaughter establishments, and then those 5 minutes, okay. Woo! All right, so that's basically what the abattoir looks like. Now farm is where our most valid opportunity to collect antimicrobial use information. So we started in 2006 with pigs and broiler chickens in 2013. And basically it's across the major producing commodities, so the provinces that have the largest commodities. And then, as I mentioned, we have the clinical side of things, which is just passive salmonella right now. So use data sources, right now we have the sales, as I mentioned, from the Canadian Animal Health Institute, and it represents about 90% of what is sold in Canada for veterinary use. We have the on-farm, where we have a very extensive questionnaire that producers and veterinarians fill out. We have the crop piece, and then from a research standpoint, we try and augment what we don't have. So we're doing various things in beef and looking at baby pigs as well. So from an integrated data standpoint, I just wanted you to recognize the complexity. We do not have one species, we have multiple species, so it's not just humans. And so each time there's a multiplier, so you can imagine the complexity of the data looking at use, but we do try to bring everything together to make sense of it. So just a bit of data, and you've seen this from other presenters. This is our 2015 data, so it may be more recent, where we estimated that the production animals represent about 82% of all antimicrobials distributed for use in Canada. Human pharmacy dispensations represent about 14%, hospital purchases 3%, and then companion animals and crops, basically 1 and less than 1%. This quantity, again, from 2015, we're seeing a bit of an uptick. So this is measured in terms of total kilograms active ingredient on this top one, and then this is basically with a denominator that allows sort of recognition of the number of livestock produced in Canada. But each one of them showing that we are seeing a bit of an increase in antimicrobial use across this sector. And this same thing, but this is where we're saying, if we use the weights that Europe uses in terms of their animal weights, this is sort of where we sit. And then if we use a Canadian denominator. So there's a lot of discussion on the denominator, but it doesn't move us too much. We're still in amongst the sort of the middle of the pack, as was described earlier. So when you have an integrated system, one of the most advantageous pieces of it is you are able to bring pieces of the data together and make sense of it. So early on, when we were looking at retail chicken in Quebec and Ontario, we recognized that there was a big difference in Salmonella Heidelberg that was resistant to ceftriaxone, and which is the same basic molecule as ceftiofur. It's a third-generation cephalosporin. So back in Back in the early phases here, we started seeing these rises in resistance. So when we started the retail surveillance, we saw this rise in resistance in both retail chicken and abattoir chicken. And this is E. coli, which actually demonstrates a good exposure model for ceftiofur resistance in E. coli. And so basically we saw this resistance emerging in Quebec. It wasn't in Ontario, but then Ontario followed suit the next year. And we found out it was representative of a use of ceftiofur at the hatchery level, where 75 to 80% of hatcheries in Quebec were using ceftiofur in ovo. So every chick was being injected with ceftiofur, and 1 minute. And so it resulted in this resistance in both chicken at abattoir. And what was more recent, now we have use information. So when we first started collecting at the farm level, we were able to collect information that 31% of farms were using it, and then the next year in 14, 6% were using it, and then as of 15, 0% were using it. And we were able to measure the impact of those changes. So in Salmonella, where we actually have human data, we can see the same sort of reduction, whereby when and this is all Salmonella, so it's sort of a flatter line than if we were looking at some specific serovars. But basically, there's this very strong link between antimicrobial use of ceftiofur in animals, resistance in animals, and resistance in humans. And when the drug was removed, we've seen a marked decrease in resistance in both the animals and the humans. Yep, I see you. I'm not hiding. I could hide right now. So again, as Mike has said, we do look at other things. So we have looked at carbapenem resistance in the food chain. We were looking at imported products, and so we did selective media looking at seafood, spices, dried jerk, pet treats, all sorts of things. And where we did find it was in the imported seafood samples. So it's recognizing that this is a risk area for importation of genes coming in to food products in Canada. And again, we pull out various serovars that are looking at high rates of resistance. And Dublin is considered a highly invasive nasty bug in humans and in cattle. And so over the last several years, we've been seeing this increase in numbers of isolates that's coming into both NML and the agri-food side of things. So we're seeing more clinical isolates in domestic cattle and more clinical isolates in humans. And more genomic work has basically shown that there's a fairly strong relationship between 0 and 17 SNVs difference, so potential zoonotic difference. Okay, I see you. Well, I'm going to talk really quickly. Okay, wrapping. We were able to look at VRE and see that it's not really coming from agri-food. MRSA, same thing. We're not really seeing much of that. So we do represent sort of the public health side. We're becoming more relevant at an international trade standpoint, and we do operate as a platform. So this is the gap slide. And basically we're kind of restricted to right now Salmonella, E. coli, Campylobacter. And we recognize that there are other organisms that are very important as measures. So some of the gram-positives we need to get back into. And then in terms of the animal health pieces, we're not really looking at any of the animal health pathogens. So, and there are some organisms that are coming up as real concern in the cattle industry, like Mannheimia, respiratory pathogens, E. coli in pigs and poultry. Again, these are creating more and more untreatable infections. So the use side, as I said, we're doing a pretty good job, but it depends on what question you want to ask. If you want to benchmark, we don't have the data that would allow us to benchmark. So we'd have to look at our surveillance in terms of how we would expand in that area. So it's just a case of how you balance the needs and requests versus the costs. So again, where do we go? Collaborated. Thank you.